Mr. Mayor, thanks so much. First, let me commend you for the tremendous leadership you've demonstrated in something none of us on this planet thought we'd endure in our lifetime, the pandemic. What kind of challenge has that been for you?
We've had to adapt to the environment that we find ourselves in because Orange County is a large urban county, the 5th largest county in the state of Florida. A lot of activity. We were at the center of tourism for all of North America and one of the top tourist destinations in the world. So managing the public safety and all of the various governmental services is a challenge any day. But when you have to maintain those services and also adapt to an environment where there's a pandemic, it created extraordinary demands on the time for my staff and all of the county workers. But we've been able to do it. People did it with a smile on their face, with a certain vigor, to ensure that we were protecting the life, health, and welfare of our community. That's the fundamental reason why most of us went into public service in the first place. So while it has been a bit of a challenge, it has also been a joy to work on behalf of the residents of Orange County.
And that brings us to the vaccine. When you talk about the safety of the residents of Orange County, right, you're very close to 50% with at least one dose vaccination, but that 70% might be a tough number to hit. If you don't, would you be willing to ease back on it so we can go without masks? Would you be willing to concede that? Because there may be a lot of people that are going to say, I don't want the vaccine.
The good news here is that while there's been a slowdown in the rate of vaccinations occurring within our community, every day there are still new people getting vaccinated. So we are improving to get to that 70% number where hopefully as a community we will not be required to wear facial coverings. I remain optimistic that we can get there. It's going to be a challenge for us, however, but if we work with you, the media, work with our healthcare experts, and work with the citizens of our community, we can get there. So our goal is to make certain that there are no hurdles to getting there. We have ample supply of the vaccine. We have adjusted our strategy of distribution and dissemination within our community by making it convenient for our residents to have access to the vaccine. So the number of locations where our citizens can go get vaccinated has increased significantly. We were taking the vaccine right into their homes, right into their neighborhoods. We're going to continue that through our mobile efforts, through our collaborations with healthcare providers, with community health centers, with the local retail pharmacies, and even local grocers have different initiatives. We will be doing an initiative with the professional sports teams here. So if you go to an Orlando Magic game, there'll be an opportunity for you to perhaps get vaccinated there. So we're going to use our creativity and we're going to use the synergy of the positive nature that we have here within our community. We've been through some tough times. We got through times where we had a terror attack during the 5 years ago with the Pulse nightclub incident. I saw our community come together during that period of time, and so I believe that our community will come together now.
So you're not going to concede that 70?
I want us to get to the 70%. And of course, if we get close and there's some reason why we don't make it, the goal is to get to the 70%. The researchers are saying that really to have the herd immunity, you need to be somewhere between 70 and 80%. So 70% is the low end of the spectrum, but this is a challenge for all of America. We will not be unique, but our local governments working in partnership with community-based organizations is going to be absolutely critical to all of our success as we go into the summer. We want to stay open. We want to stay well also.
News 6 is...
Can I pause you for a second?
Yes, sir.
What I was going to say to you is that we still see 200 to 300 new cases in our community of COVID-19 each day. We also continue to see a death or so every day. So for those families who have had a loved one who tested positive or who had a family member who died, they all matter to us. And so I say to them, you know, if we were approaching our response and recovery efforts without regard to the human side of what we're dealing with, I think we would miss the boat. And so here we have made that a priority to humanize the experience that we're going through and understand that not everyone is going to feel comfortable taking the vaccine, but the goal is to those who are perhaps ambivalent about it, we want to convince them that they should do it for the right reasons.
And to catch the attention of those that are reluctant, maybe on the fence, not sure, they don't feel safe, you went public and had the vaccine. What did you get? How did you feel afterwards?
I had my first dose of Moderna back in December, one of the first public officials here to get the vaccine. I had the second dose in early January. I had no issues whatsoever with the first dose. The second dose, I had a little bit of fatigue, but I did not get sick. I didn't get a fever. I didn't get some of the flu-like symptoms that other people apparently had. So I have to say that overall my experience was good. Every adult member of my family has received the vaccine, including my father, who is currently 98. In September, he'll be 99 years old.
Wow.
He really had no side effects from it either. And then, of course, all of my siblings and my sons, who are all adults, they have all had the vaccine.
So you believe in this, and you believe that the people of Orange County should get this vaccination without reservation?
I believe that the people of Orange County absolutely should get vaccinated. I have been fortunate. I never contracted COVID-19. I followed the CDC guidelines, and because now I've been vaccinated for about 5 months, I think that helped to protect me from getting the virus, and whereas sadly other people have contracted the virus who did not have the opportunity to get vaccinated.
I'm curious, did you have a staff member, constituent, maybe family member that was reluctant, but then you convinced them? And how did you convince them?
I have family members who work in the healthcare field, and some of them were saying, I don't know if I'm going to be in the first wave. But then I had family members who tested positive, and that drove them to, I need to do something here, and they went and got vaccinated.
You and I were young once, and the young people are saying, this isn't going to touch me. And unfortunately, yesterday at 4:30, you briefed us on an 18-year-old who we lost to COVID. Now, I know she had underlying symptoms, but I think it underlines the fact that the young people are vulnerable to this too. How do you convince them?
Young people are vulnerable to it. We had several of our firefighters and correctional officers who were young, in their 20s, early 20s, who were hospitalized as a result of testing positive, and one spent several months in the hospital, but ultimately was released. And so that says to me that this is real. I had some other friends and relatives, acquaintances who died of COVID-19. So it's not a joke with me. I know that it's real, and I just hope that people pay attention to the experts. A lot of people are getting their information by going to the internet, they're Googling it, and they're using the Google doctors. But I would say pay attention to those who are truly the experts involved in the research and get paid to tell you the truth about the matter. And we have relied on our hospitals and the Department of Health and our own physicians who work for Orange County government to help provide the advice to me as we have shaped public policy.
The governor took an aggressive move, signing into law mask mandate county by county done. Basically saying the mayors across the state, don't bother, you don't have to anymore. Taking the control out of your hands. I know you were considering legal action, looking at what the governor had done. Have you gone any further with that? Is a lawsuit a potential in this?
Our county attorney's office is still doing the research. They are in communications with other local attorneys, public sector attorneys, and having conversations. There are several cities and counties around the state who are exploring what our options are. But in either case, we will make a decision in due season whether or not that is something that's practical or not. But I have not allowed that to stop me from making decisions and giving guidance to our community. We, just prior to the governor's announcement, provided a three-phased approach to true recovery within our community. And that was based upon input that I received from the experts, physicians, researchers at the University of Central Florida, information provided by the Department of Health, information provided by our hospitals, and we made the right decisions at that time to give guidance because almost daily someone in this community was asking me, when do you think we can remove our facial coverings? When will we recover? So I wanted to give them guidance about how to go about doing that. The Centers for Disease Control issued some updates, and shortly after receiving the updates from the Center for Disease Control, the very next day we announced this three-phase approach, which is still relevant today. We don't really need the governor's executive order or the local executive order to really accomplish that. And I would say to you that the overwhelming majority of those who run businesses, including the large theme parks, have all agreed, voluntarily agreed, that they will follow that three-phased approach because it was based on sound judgment and input, and they want to do the right thing to protect their patrons and their employees. And so you're still going to see people wearing our facial coverings in our community because of consumer confidence. There are many of our residents that just simply do not feel comfortable yet going around people who are unmasked because they know 200 to 300 people continue to test positive every day. There are still people who get hospitalized every day. Those numbers are slowing down, but the fact of the matter is until you get vaccinated, you are very vulnerable to contracting the virus. We have 10,000 variants that are out there that the researchers really don't know a whole lot about at this point. So it behooves you, if you really want to protect yourself and your family and remain as open as we are here at this period of time, do the right thing and go get vaccinated.
And the masks stay for now.
And the masks are staying. You know, I continue to wear my facial covering, and I've been inoculated for 5 months now. But not knowing truly the potential for the variants, I think that I have to protect myself. In this leadership role, if I contract the virus, I get sick with the flu. That creates a challenge for me to be able to continue to lead. So I take my responsibility very seriously as a mayor of Orange County to be available for the residents of this county.
I mean, you're great at diplomacy. When you were at the barber shop with the governor, everything seemed great. Have you had a chance to reach out to him and say, I think I know what I'm doing? Have you been able to talk to the governor?
The governor does not communicate well with those at the local government. Quite frankly, I don't think he communicates well with many people who are not in his party. But the fact of the matter is, when you are elected governor or to any other elected office, regardless of how you got there, you represent all the people. And my concern has been the marginalization of those at the local level, the arrogance, if you will, of believing that you know better than what we know. Listen, I have 40 years of public service experience, and I've had the kitchen sink and everything else thrown at me during that period of time, where I've had to be decisive to make decisions that kept people alive. Not many people can say that where they've had the privilege of making life or death decisions, but I have. Because of my nearly 38-year career in law enforcement, I saw it all. So I use the sum total of my training and my experiences that helps me today as the mayor of Orange County do what I have done now for 4 decades. The governor can't say that. Okay, I've been on the ground. I know this community. This is where I was born and raised. And so I believe that I'm more familiar with what really needs to happen here in Orange County than someone who lives somewhere else or who has never lived in this community. And so I take that responsibility very seriously and deserve to have the communication, the open lines of communications. In my 40 years, I have had the privilege of working with many governors during that period of time. I was appointed to many statewide boards and other entities by Republican governors, by a Democratic governor. And so I expect that type of openness and relationship building. So I'm not adverse to working with the governor. Certainly I have reached out to the governor numerous times during this pandemic. We were successful in negotiating and nudging the governor in a certain direction to get barbershops and hair salons back open, and I appreciate that. There were times when, as we reopened our economy, we appointed an economic recovery task force. Many of the members that we appointed here also did double duty and served on the governor's economic recovery task force. We have worked with the state on a daily basis with the Department of Health, with the Florida Department of Emergency Management, and other state entities, as we should be doing. And I'm the type of person, I'm very open. I have been appointed by Republican administrations to some high-level positions. I was public safety director here in Orange County, appointed by a Republican. I was chief of police in Orlando, appointed by a Republican. So I don't, my politics are really more to the center. I care more about the people and less about the partisan politics, and will never make my decisions based on partisan politics. And so that's what I expect. That's the standard I expect from every other elected official. And so the governor can improve. There are previous governors, again, that I worked with that had the opportunity to communicate with us, and they did so. Governor Scott, I had a wonderful relationship with Governor Scott. Governor Scott will call me from time to time. In fact, during the pandemic, I received phone calls from Governor Scott at various times. And so I have to say, it's not about me. That the reason why we don't have better communication is rests with the governor.
So we're not hearing his voice on the phone to the mayor's office?
No. And from time to time, I hear from a staff member of the governor that contacts my chief of staff, but the governor has never picked up the phone and initiated a conversation. There have been some times, quite honestly, where I had some conversations with the governor, but they were all initiated by me, where we contacted their office, and at a certain time, we were able to talk directly with the governor. But here recently, he's shut down all of that, and this isn't unique to me. I hear this. You can ask Mayor Dyer and some of the other mayors around the state. Being the mayor of a county is very unique. There's really probably only 3 counties in Florida where there's a countywide elected mayor or semblance of such, and that's Miami-Dade County and then Jacksonville, Duval County. So we're somewhat unique in my role and responsibilities here.
And the population that you
And the population, 1.4 million people live here. We're the #1 tourist destination. I'm responsible. I got elected by the people here to represent them in various ways, and that's what I endeavor to do. I have great relationships at the federal level, state level, very active in the various associations. So it's all about the influence on behalf of the people. I choose to get involved with various organizations so that we, the people, have a voice in appropriate places.
The people are looking forward to July 4th, and I have to ask you this. Altamont Springs has decided no 4th of July celebration. Do you think that should be the course for people across the state? We probably should hold off on 4th of July celebrations. What will your policy be on that?
I believe that we still have just a few weeks left before we have to make that critical decision. So if our people really are interested in celebrating the 4th of July, go get vaccinated. Let's get those numbers up, and we can do so in a safe manner. I know that the City of Orlando is still exploring what the 4th of July activities will look like. That tends to be the center of where the celebratory activities occur within our county, usually within the core, the downtown corridor. But our theme parks, they're going to be prepared. There will be many people who are going to celebrate the 4th at our theme parks. Our theme parks have significant sanitary protocols in place to make sure that their guests are protected during that period of time. So I'm excited about that. We'll have guests, visitors coming in. Our summer convention business is going to be very active, and we are working with all of those show administrators and coordinators to make certain that those are safe environments as well.
Get results, get vaccinated is what News 6 is doing today, Mayor, and we thank you so much for being with us. What is your message to the people? In your heart, they should get vaccinated, even those that are not sure right now or afraid?
I believe that those who do not have any medical vulnerabilities, who are eligible to get vaccinated, should get vaccinated.